Okay, I'd like to welcome you all to the first virtual patient education conference. My name is Joanne Popham and I run the Paul Popham Fund Renal Support Wales. This event is a collaboration between Kidney Care UK, Kidney Wales and the Paul Popham Fund. Our three charities came together at the end of last year with the aim of organising and holding a joint patient education conference in South Wales on the 12th of June 2020. Due to the pandemic, this was cancelled with the aim of reorganising in 2021. Until there is a confirmation from Public Health Wales that we can organise and hold an official conference, we decided to organise a series of virtual conferences to keep you updated with the guidance and services available during this time. Fiona Loud, Director of Policy Kidney Care UK, will start the conference by discussing the main concerns raised from a joint survey called Worried Sick. Fiona will be followed by Mike Stevens, Consultant Transplant Surgeon at the University Hospital of Wales, who will provide advice and guidance following on from the concerns raised in the survey. The conference will take an hour. During this time, all microphones are muted. You will have the opportunity to ask questions. Please use your Q&A chat function and not the chat function. I'll just repeat that. At the bottom of your screen, there'll be a Q&A button. Use that to chat and ask questions and not your chat button. You will have an opportunity at the end to give your feedback. We hope you gain some invaluable information, and with that in mind, I would like to now hand you over to Fiona Loud.
Thank you very much. Thank you very much, Jo, and thank you very much indeed to Kidney Wales and Paul Popham Fund for asking me to come and speak this afternoon to everybody. Thank you, Jo, for putting the slides up there. So this afternoon's patient conference is between the three charities, and I'm Fiona Loud. I'm the policy director for the charity, but I'm also a kidney patient myself. So I've been running through the shielding myself for the last few months and experiencing many of the things that you guys will have experienced. I had a transplant 13 and a half years ago after 5 years on dialysis. So is this discussion, perhaps could you just pop back one, Jo, please? Thank you. So this discussion, are we looking at now at sort of a place 6 months on, perhaps from the pandemic when it started, should I say? It hasn't finished. And are we moving on to something that could be called a new normal? It's not the normal we were used to, or are we still, worried desperately about everything that's going on? And I suspect it's going to be a bit of both. And we'll look at that and the survey and your views in just a moment. If any of you are doing Twitter, you can see our various names at the bottom of the screen there on the right hand side, and we're using a hashtag called New Normal. So if you want to share this with anybody who's not taking part, please feel free to do so. So next slide, please, Jo. So first of all, I thought it might be useful to know, although I'm sure you do, that we're not alone in this. 2.2 million people were advised to shield, which is something we never really thought of in this way back in March. And we have the Office of National Statistics, which runs a lot of surveys about people's views and experiences as they went through. And I thought it might be worth sharing this particular thing. So this was in July, so shielding hadn't yet finished. There had been some advice that people could go for a walk during that time. But nevertheless, you can see the numbers of people there who hadn't left their home or garden. Not everybody has a garden, of course, since they were advised to shield. And you can also see there that many people didn't have contact with friends or family. This was just a snapshot, but it gives you an idea of what everybody was undergoing at that time. So some very profound patient experiences. And if you could just have the next slide, please, Jo. I wanted to just cover off what happened then. So we decided that it would be important to hear from you, to hear what you were undergoing and how you were experiencing COVID. There's a lot of anecdotal stories, and then we had a lot of feedback from all of you through our various charities about the difficulties. But in order to do something meaningful with that, we felt it would be a good idea to collect those views, put them together, and then use them to change and influence policy. So we devised the first COVID-19 patient experience survey in May 2020, and we called that one Worried Sick, because somebody had just said, I'm worried sick about all this, perhaps in one of the responses. I can't quite remember where it came from, when we published it in June. And so here are a few of the things there. We're going to come on to the Welsh survey in a moment, and the findings are pretty similar. You'll perhaps not be surprised to hear. So 4 out of 10 people at that time reported either a very serious or a serious impact on their mental health. And some of it may well have been related to the slide I showed earlier from the national stats there. Nearly 7 out of 10 people reported disruption to their care. So whether that was not being able to get an appointment, whether that was a cancelled transplant, or whether it was simply not knowing who to ask or to speak to because there were some more local worries that perhaps you might have wanted to talk to your GP about, but not wanting to kind of worry people was something that came through quite clearly. And I'll say some more about this in a minute when we talk about the the Welsh survey. 25% of people reported worries about getting food, and a lot of people came through to all of us with those worries, because food boxes were something that was made available. There were voluntary services as well, but at the very beginning, and as time went on, people were quite confused about government advice, so they definitely didn't get the message about what would be available for them. And that's a link at the bottom of the page there, so if you want to go into it, have a look at some other time about our report. And I can see that I've got a typo in it, but apologies for that. Okay, if we could move on to the next slide, please. So what's the point of doing that? As I said earlier, to collect people's experiences, collect people's views, and what they're actually undergoing during this completely unprecedented time when COVID-19 came upon us, was to provide evidence for policymakers and renal services, and also for trusts as well. So in England, some of this work is now being used by commissioners to start to rebuild or restart. It's something that people in a range of areas, and there's other areas than the ones I've mentioned there, to look at and say, well, hang on, if this is what was going on, what can we do about it? What does that tell us about where we need to go and where we need to focus? And we are very keen to take it further. We are very keen to work across all the countries in the United Kingdom to take that further, to make sure that what you experienced isn't lost, but it is used. Something else that happened, and it's at the bottom of the page there, was that we were approached by a number of people to for other surveys, and so what we decided to do in the end was just put some COVID research opportunities on our website. So if people are interested in having a look at that or taking part in other research, then there's an opportunity there. So if we could go on to the next slide, please, to the bit you're probably the most interested in, because this is what happened in Wales. What we decided to do then, the 3 charities together, was slightly adapt it for Wales. So pick out the different areas of Wales and change a little bit of the language, but largely use the same kind of question, so we could compare and see whether there was much difference or not. And there wasn't very much difference, but interestingly, this was July. The survey closed on the 7th of August rather than the May time. So I had probably thought there might be a bigger difference than there was. And what we heard from all of you was that nearly half of the patients responding didn't feel confident to shield to the expected level. And some people didn't even know what was the expected level. Does that mean, hiding away inside forever? Can I go out for a walk? You heard me mention earlier that there was a bit of a change in advice partway through. And the other thing that was interesting, and perhaps quite a challenge for everybody, was that it might change in one country sooner than in another country. So there was a bit of that to work out which country we were talking about and where the changes were. And nearly half of people found it difficult to access government support. And I'm going to talk about that again in a minute. And as we found everywhere elsewhere, there was a lack of clarity on who exactly should shield. So people, for example, on dialysis, people who'd been in intensive care for a period of time, is that me? Do I need to shield? And where did the messaging come from? So some people almost just never got that advice, or didn't get that advice from very late on. Some people definitely got the advice from the kidney units, and you've got some excellent kidney units that work very hard to do that. But part of the problem was that if you weren't recognised on a government portal of some description, it was quite hard then to get the support that we've referred to earlier, and I'll talk about a little bit more in a minute. So definitely a lack of clarity there, and it's still going on for a period of time. But every single person that responded to this survey wanted advice on COVID-19 and shielding, because we do know that advice, good information, is absolutely vital when we're in a really uncertain situation. So the next slide, please. So perhaps not surprisingly from the first slide I showed in this talk this afternoon, but this was from kidney patients, of whom so many of you reported serious concerns about loneliness and isolation, and 1 in 4 reported some concerns. So that's what, nearly 3/4 of people who responded. And more than half, and it goes back to my theme before about clarity and information, more than half didn't know that there were volunteering services out there to help them, or that they were eligible, or how to contact them. So if you didn't know the services were there, you may not be able to, perhaps you didn't access food or food boxes, and you didn't know how to get hold of those. And those were kind of the ongoing concerns there. And there was a lot of, there's a lot about food that came through in these surveys. And one of the things that really sticks in my mind is people contacting us and just saying, we can't go out, we don't know how to get food. Some family members were able to help some people, and some of you, after a period of time, were able to get priority delivery from supermarkets. But that did take a piece of time, and that was one of a really big thing that came through consistently. So would you be able to pass on to the next slide, please, Joe? The next theme, and I don't think this came through quite as strongly, but because there was a slight tweak in some of the questions, as I mentioned earlier, not too much, but there was one, and we heard a lot about the serious financial impact on you, partly to do with the effect of shielding, and partly to do, of course, with the effect of COVID as well, an employment situation being, as we know, quite challenging. And so there were lots of calls for support on what people's rights were, and lots of worry about that too. So we are working. We continue to work together. Certainly, one thing about COVID is it's brought all our organisations really closely together. We were working together before, but this has brought it on. Continued campaigning right now for employment support, perhaps for continued furlough if that is in any way possible for people, and a couple of other things. I wonder if you could just pop back, Joe, to the last one. Thank you. And I just wanted to mention something about family members. This came through in the survey. So family members chose to shield, and some of them had the employment concerns, and then there were others who simply weren't able to do so. And so that was another level of concern for people about keeping themselves and their loved ones safe. So next slide, please. And then almost just coming kind of quite close to the last 3 or 4 slides here, access to treatment. I mentioned it before, but here are the figures from Wales. People having their, from the respondents, people having their treatment or appointment cancels, and others unable to access monitoring like checkups, general health advice and blood tests. And we're all concerned about people who are close to kidney failure and that they are able to get or they are getting their face-to-face care as much as they possibly can, as soon as they can. And of course, that was another reason for reporting anxiety about those treatments, because we're all aware as kidney patients that monitoring is very important. So next slide, please. So where are we now then? So we know some things. We know that kidney patients have undergone some very challenging times. What next? So you'll not be surprised to hear that we want to see, based on this, some prioritization about monitoring and treatments, about mental health. I'm going to mention clarity on future lockdowns. I know Wales has fortunately not had any of those yet, but we heard about some more in Scotland yesterday. I think we need some more clarity on what happens to people who were previously on the shielding list, and the shielding lists have been maintained in case there has to be some kind of lockdown or something in the future. So where there is a lockdown, what does that mean? Will there be financial support in place? Does that mean people have to reshield? Because what's happened so far is it's been mixed. In some areas, those things have come into play, and in other areas, they haven't come into play. So we're not quite sure where that leaves us. And you may have heard something about the NHS and NHS restart. which is basically some guidance that's gone out across the country about getting gearing services back up again as much as is possible, considering that we're still in the midst of the pandemic. And then finally, if we do go into more of a lockdown again, continued support for accessing food and medications. So next slide, please. Thank you. So there is support available for all of you through each of the charities. This is not all the things that people do, of course, but we're there by phone. There's meetings, there's kidney cafes, there's webinars like this, there's counselling and advocacy services, and there's also patient information. So we have what we've got here is almost, I would say every day, but it's not every day now, probably 3 times a week. We continue to update the Kidney Care coronavirus information on behalf of the whole nation. We try to keep up to date with every single country, and obviously we're really willing, if you let us know things that need to be changed, we're happy to do that. And in the last few days, we've put in something that you can go straight to about going back to school, more of that later. And we've also put in some more information about employment benefits. So next slide, please. So, and someone's just asked me about how many respondents there were to this. So the national survey that Kidney Care ran, there were over 1,200 respondents. There are about 50, I think, and Jo can confirm that in a minute, respondents to this survey. So that was just a response to a question that Susan just asked. So as we come to the end of this then, so here are some of our goals that we'd like to see based on what you've told us in Wales and what you've told us across the whole country. So that prioritisation for personalisation, for personalised advice, a clear plan to provide kidney patients with mental health support and an acknowledgement of that issue, a commitment and actually some action from government to provide simple, direct and accurate and timely information. We need that now more than ever. And and also guidance from the NHS as well to enable us to protect ourselves and access critical services. And finally, some assurance that it's safe, and I know Mike will talk about this later, that it's safe for us to access healthcare and essential supplies, and what happens when we need to self-isolate. So next slide, please. We come to an end. So what next then? Let's use our voices to work together. I think working together with our clinicians, with our charities as patients tends to have, I think, more power when we're singing from the same hymn sheet. Let's acknowledge those challenges and remember that mental and physical health needs won't wait. So if you need care, do, and Mike will talk about this, do of course go to the hospital, go to your units. And though all of those things together will help us to work together to rebuild some confidence as we're living in this COVID world, and as yet, there are risks still out there and we don't have a vaccine. I would like to mention that we are incredibly grateful to the NHS for the service and the support they've given us throughout of this, although I've been pointing out lots of things that need to change and need to improve according to our various views, but the NHS has been amazing nevertheless in supporting us through all of this. We've got that distance aware badge that you'll all be aware of, which is fantastic. It came from Wales. We've supported it all the way, and there's a Kidney Care version of that as well. So that's been a great thing because the social distancing is still really important. And also just a really quick plug that just this week we have now launched a post-shielding survey, so we can learn how are people feeling now as we move on, and again use that in the ways I've just mentioned. So there's a couple of questions come up. While I look at those, just very briefly. I think what we'll do is we'll look at some of those questions when we talk with Mike, and I'll speak to him about that as we go through. But I think I'm going to hand over to Jo. And Jo, there is a question for you that you might like to just mention, which is what are kidney cafes, and that's your meetings as well. So would you be able to comment on that as well? So thank you everybody for listening to me.
Thank you, Fiona. In answer to the number of respondents, yes, it was just under 50 for Wales, and there were just under 40 in the whole UK survey. Kidney cafes are support groups that are online. You can join them via our website, which is the Paul Popham Fund. They are online support groups where they run monthly. I think after the presentation you can have our contact details, and we can share further information on how to access them. But you can access them on our website, which is www.paulpopandfund.co.uk. Was that all the questions?
Yeah, that's lovely. There was one other question actually from Lee, which I'll just respond to, which was about the UK government and informing the devolved nations of their plans. What hope do we have? Well, what I would say is that what we've done through this is we have built communication with the Welsh, Scottish, and Northern Ireland government, as well as the English government, as well as the Westminster government, and that we do get told quite regularly what the updates are to the regulations and so on and so forth. So we do our best to represent that as much as we get it across the country, and that's why I say we update information as regularly as we can. And certainly with Judith, Joanne, and others, we've met and talked to Welsh Government about guidance and as it's going to be produced, and fed back a little bit of what we talked about today. Is that fair to say, Jo?
Yes, definitely. Yeah, working with the 3 charities. Yeah. Great. Okay, so shall we hand over to Mike? I'll just mute and hand over to Mike Stevens.
Thanks, Jo, and thank you everybody for inviting me to talk this afternoon. It's great to see the kidney charities who represent us in Wales get together like this, so it's really positive thing. Unfortunately, I have to do this online this year, but hopefully in the future we'll be able to do this with face-to-face meetings. So what I'm going to go through with you this afternoon in the next half hour or so, I'm just going to give you a little bit of a background about why COVID has been a problem specifically for renal patients, and then talk a little bit about the different levels of risk for different patients. So I think one of the things that's really important to remember is that not every patient is the same, and the level of risk that goes with COVID isn't the same. So we'll touch on that a little bit. Then I'm going to talk a little bit about the transplant programme, what's happened with it in Wales and across the UK, and where we're going in the future with that. Then I'm going to try and just take a couple of specific areas that I know raise anxiety for some patients, in particular about this time now where children are going back to school and how that affects the kidney community, and how about going back to work. And then likewise, if there's any patients who should be thinking about whether they should be continuing some kind of self-isolation or when that might be appropriate. And then I'll hopefully wrap things up talking a little bit about testing, antibody testing, antigen testing, and a little bit about the vaccines as well. Okay, so background wise, why is COVID-19 a particular problem for kidney patients? Well, it's really important to remember that there's a huge variety of conditions that all sit under the same umbrella of kidney diseases, and there are some patients within that group who are particularly prone to both picking up infections and also to getting a more severe version of infections, and this is really relevant to us in the kidney community. If you look at COVID-19 as a disease across the whole world, what we know is that the single biggest factor that affects outcomes, the single biggest factor that causes that's associated with worse outcomes is age, and that's no different for our kidney community. So the older you are, the more likely you are to have a severe version of this infection if you were to pick it up. And of course, a good proportion of our kidney community are in the older age group. When you add on top of that the fact that there's a large number of our patients who have a dampened immune system, a lower immune system for one reason or another, in particular because they may have had a transplant in the past and maybe taken the anti-rejection medications, or perhaps they've had a treatment for their kidney disease that have lowered their immune system, that will make you more prone to contracting the virus and more likely to experience a worse episode of it if you were to have it. So It's particularly relevant to us as a community, and this is the reason why right from the start kidney patients were included in the list of patients who were advised to shield. And you might remember right at the very outset it was only transplant patients who was on that list, and as things evolved, different groups of patients were added onto it to include dialysis patients as well. I think that one thing to remember throughout all of this is that anything that I can tell you or any advice I can give you is based on 6 months experience with this. This is very new. We don't have all the answers to this as a medical professional or as a community. It's changing all the time, and we're having to evolve with that. And a lot of what I'm saying is based on loose evidence or limited experience. So we need to be willing to adapt as we go forward. And the other thing to remember is that each of you are individual as a patient, and the level of risk that are associated with COVID-19 or of treatments related to kidney disease at the moment are going to be very different for each of you. So the best source of information that you're going to have are your kidney team, but remember that they may not have all the answers for you. They may not be able to completely individualize your risk and give you a figure, because we just don't know that at the moment. We've certainly come on an awful long way since March, when this really started to bite. And I think that there's no doubt at all that we're in a much better position to be able to manage any future changes in infection rates in the community now than we were back then. The same as any time I talk about managing kidney diseases, I think the thing to remember here and the thing to focus on is not what we can't do, but focus on the things that we can, because there are some things, particularly at the moment, that are a higher risk for you because of COVID, but there are also plenty of other things that you can do safely that may be able to just be substituted for one of your previous activities and keep yourself well, but keep yourself active and keep yourself engaged and keep your quality of life up. And that will be different depending on the individual. So please bear that in mind. There are some really useful resources that we have available to us already that are available on the internet if you can get access to have a look at that. Joe, I don't know whether you can put up the first infographic on the screen so that everybody can see it. There's a couple of really useful infographics that you might find useful. You can find these if you go, probably the easiest way to find them is go to the Kidney Care UK website, and you'll find it within the COVID-19 advice section on there. There's a link to this. It's produced by the Renal Association, or a collaboration between a variety of professional organisations in Kidney Care UK and the National Kidney Federation. What this particular one shows us is that actually, Joe, can you put the other one up first? Actually, we'll come to this one in a minute, but if you show the other one first. So this one tells us, gives us some indication as to what the level of risk is for you as an individual. So what you can do is you can find yourself in each one of those circles, and you can put yourself into a risk category. So the lower risk being, in general, males have experienced more severe episodes of COVID-19 than females. So if you're male, that puts you immediately into the moderate risk group. The younger patients tend to be at lower risk. Weight is a big factor. If you're obese or significantly obese, then that's a big risk for severe outcomes. And if you have had a kidney transplant or any other organ transplant, you automatically fit into the higher risk group. So it may not be that every one of you is in the higher or moderate risk group. If you've got early kidney disease and you're young and you're female, then your risk is actually relatively low of a severe episode of COVID-19 should you acquire it. And maybe you would want to consider that when you're making your decisions about what sorts of activities you want to be getting involved with now as shielding is relaxed. And likewise, you might look at this and say, well, I've got 3 of those factors in the higher risk group. I'm going to be more careful with what I do on my day-to-day activities. I would like to be more cautious and perhaps not go to supermarkets and perhaps keep my social group to a minimum to try and minimize those risks. And that will be perfectly sensible and reasonable. What's important is that, as is always the case, the role of the medical professionals is to try and figure out the information, the data, and put it together in a format that you can understand as patients and deliver that to you, and you can use that information then to make your decisions about your particular situation. And it's only you who's going to know how much how much you want to do these various activities. Joe, could you put up the other infographic now, please? So this is the second one that I think is really quite useful. And as you're planning now what you want to be doing with your lives for the next few months, this gives you some indication as to what the chance of you catching COVID-19 are from these various activities. And they may not necessarily be intuitive. So you might not automatically look at this and think in your head, well, that's a high risk or that's a lower risk. But these have been worked out quite carefully based on data that we know at the moment. And you can see that things like going on a quiet beach or even going camping, having a dinner outside, going to the supermarket are actually relatively low risk activities in terms of catching COVID-19. But on the other end of the spectrum, if you were something simple like shaking hands with people or hugging people, going to an indoor party, going into an indoor bar, having a buffet, those are the sorts of activities that actually are higher risk of passing on the virus. So particularly if you find yourself in that higher risk group, these are the sorts of activities that you probably want to think carefully about doing. You perhaps want to avoid doing these things in particular. Again, you need to individualize this, and you need to think about how much of an impact it would have on your life to cut any of these things out or to avoid them completely. And again, what I've been encouraging you to do is to try and swap things around. So don't say, well, I can't exercise because I'm shielding or because I'm a higher risk. But think in a different way. If you're in the highest risk group, then you may want to be cautious about going to a gym, for example. But there's lots of other activities that you could do instead. Certainly exercising outdoors on your own or with a small group of your family would be absolutely fine. Things like actually swimming is a relatively low risk activity, providing the sort of getting it in and out of the pool. I think they're pretty safe at the moment anyway. I don't think the change rooms and things are open, so it's being done pretty carefully. So think about it as a use this information to try and tweak your activity profile rather than stopping things in particular. It really is the case that you can be doing activities at the moment if you're careful about it. And that's the way to think about this, really. So have a look at those. Those infographics are there on as I say, go to the Kidney Care UK website. That's probably the easiest place to get them from. There's a link in there. And there's lots of other information on all the charity websites actually that are really useful relating to COVID-19 and specific for kidney patients. So I said I'd talk a little bit about the transplant program and transplant programs in general. So back in
Mike, just one really quick question that's come up. There's a few, but this is one really quick one. Somebody has asked about what about hugging your grandchildren, not face to face, but hugging them.
This is a difficult one, and we're still evolving the information on this. I think that the information that we have at the moment suggests that that children aren't at high risk of passing on the virus to adults, and that's different from other infectious diseases, and in particular influenza, which initially we were kind of making lots of comparisons to, which is easily passed between children and parents. And children often get very mild symptoms or no symptoms, but can pass it to their parents. And that's why when we have an influenza pandemic, one of the first actions is to close the schools, because that will affect spread. It doesn't look like that's the case with this virus. We don't know for sure, but it doesn't look like that's the case. So it seems that small children are lower risk. But I think we probably need to be wary of that and keep our eye on the data with regards to that. I mean, my suggestion really would be to try and keep your social groups as tight as you can at the moment, if you are someone who's in that higher risk kidney group. So if you're somebody who's in the higher risk, maybe a transplant recipient, think about trying to keep your social groups as tight as you can. And your grandchildren, they're going to be part of that group, I'm sure. And I wouldn't be suggesting that you should be avoiding grandchildren at all, because, that's just, that's what life's about, that sort of thing, isn't it? So be sensible about it. If your grandchildren are coming round, turn it into a game, get them to wash their hands as soon as they come into the house, because that really does make a big difference about transmission of the infection. And be sensible. Maybe just don't expand it to their friends and their friends' friends, and maybe avoid the grandnieces and things like that, perhaps. Fiona, what do you think?
Thank you. Yeah, absolutely. And there was just one other thing that's come up, and you might tell me you're about to do that anyway, and it's just about going to school.
Well, let's take that now, as we're talking about children anyway. And I think we were really anxious about this in the early days, and I think most transplant units and most kidney units were advising their higher risk patients not to send their children to school at the end of last term. I think we've probably changed our attitude now and are saying, well, there's a number of things to bear in mind there. One, it's not really practical. From the children's perspective, obviously, it's harmful if we're keeping them off school. And the evidence is not suggesting that children are big vectors of the disease. So in other words, they're not carriers and they don't pass it on so much. Again, I would say be practical about this. So if your children are going back to school, try and be careful about taking them. If you're taking them, when you're actually physically taking them to the school, and try to avoid other adults when you're there if you can, the strangers at least. And when your children come back, get them to change their clothes as soon as they come in and wash their hands. And just try and keep your risk as low as you practically can. But I certainly wouldn't be suggesting that everybody should be keeping their children at home at the moment. But perhaps the thing to do is just let's see how things go over the next few weeks and be prepared to change that. But I really don't think that's a high risk activity. On a similar level, going back to work, it's a similar sort of question, really. Should our kidney patients be going back to work? Is now the right time? What I'd say on that one is that the government advice is probably correct on this one, and the government try to get their advice correct on everything. The problem with it is that by its nature it has to be generic, doesn't it? So some of the advice there may not apply quite so well for our kidney patients. In terms of going back to work, what I would say is, first things first, if you can work from home, do it. Okay, there's an option to work from home, just do it, because why not? That will keep your risk lower. So I do not think that this pandemic isn't going to last forever. We may be left with some coronavirus as an issue in the longer term, but it's not going to be as it is now. So for the time being, certainly over the winter, if you can work from home, then do it. If you can't work from home, then the question is, can your work make the environment COVID safe? And that's their responsibility to do that. It's not your responsibility. They are legally obliged to make every attempt to make the workplace safe. And if they can't make the workplace safe, then it would be I certainly wouldn't advise you to go back to work if you cannot reassure yourself that the workplace is safe. And there will be some work environments that's just impossible. It's impossible to keep it completely COVID safe. And in that scenario, I think you need to think very carefully about going back to work. Fiona, any thoughts on that?
Yeah, thank you. There was just one other thing, a bit of clarification about the children. And that advice was for parents who have the kidney disease sending their children back to school, rather than children who might have kidney disease going to school. So maybe it's worth just saying, I know you're not a paediatric surgeon as such, but maybe just make a comment about the children with kidney disease.
Well, I think that for children who've had a transplant, again, check with your transplant unit, because there will be an individualized element to this. A standard kidney transplant recipient who's a child, as long as it's not in the early stages after a transplant, so the first few months, it will almost certainly be safe for them to go back to school. I would be advising and suggesting that you are as sensible as you can be with the social distancing as much as is possible within the school environment. But it should be safe for the children to go back to school, even if you're a transplant recipient. I can completely understand why you're going to be anxious about that. And I can understand why probably the transplant recipients, adult transplant recipients who have children, are probably a little bit anxious about that. But there are things that you can control within this. And, I'm sure the school are already aware that your daughter or son is a transplant recipient, but just emphasize this again to them before they go back, and ask them to reassure you of the measures that they're taking to ensure your child's safety. And I think there are ways of allowing it to happen that children can go back in school. And, all these things. Remember the benefit of schools and education. Remember the benefits of work. Remember the benefits of socializing and physical activities. These are all really important for us. That's that's how we evolved as humans. We're designed to do these things. So we want to try and be as sociable as we can be. We just might need to do it a little bit different than how we used to a year ago. But that's okay, we can learn. We've learned loads of different ways of interacting and socializing and all sorts of other things throughout this pandemic, that's many of which are better than we used to do. We just didn't realize. So embrace it, look at the positive, look at the things you can do, not at what you shouldn't be doing.
Brilliant, that's really, really encouraging, thank you. I just want to allow enough time for you to talk about transplant, but there was just one point that Sean made about financial support for people who aren't able to work. And I think that, from what I've said already, that's kind of a bit of a campaign rather than anything. And there's some unanswered questions about what might happen in the future and how easy the process of claiming statutory sick pay is and so forth. So I think we'll have to come back to you to answer some of those questions specifically. That have they been raised? Yes, they have been raised. Unless you've got anything to add to that, I just wanted to comment on that and then take it back to you for transplant.
Yeah, there's slightly more support for shielded patients than for the other members of the population with respect to that, but it's not ideal yet, and we've got work to do, and the charities are working on your behalf to try and improve on those things. So we'll see where we end up with that.
Yeah, we have definitely work to do.
On the transplant side, so most transplant program, well, all transplant programs, kidney transplant programs, to some degree, scale back or stop their programs in late March and April, and the reasons for that were because of lack of control and reassurance about safety. So we weren't in a position at that point where we could reliably test organ donors to exclude coronavirus. We weren't in a position at all to test our recipients to make sure they didn't have coronavirus, and all of the data was showing us that transplant patients, particularly people who just had a transplant, if they got COVID-19, they did very badly. A high proportion of them dying, unfortunately, and unfortunately we saw that in the UK. So some of the transplant centres who initially tried to stay open and continue transplanting experienced some really terrible results. So the safest thing to do for everybody was either scale back or stop. And that depended on what the places that managed to stay open to some degree did so because they were in a hospital that didn't have any admissions with COVID-19. Anywhere that had COVID-19 patients in the hospital, they stopped. Now, as time's gone by, we've learnt that there are ways of changing the environment to manage the risk. And that's what everywhere's done. So a few key things have changed. The access to testing of the recipients, testing of the donors is extremely robust now. So there's an absolutely vanishingly small chance of an organ donor having COVID-19 and therefore passing it on. And we didn't know that early stages. There was no testing going on in the donors in the early stages. The recipients are all carefully tested. And the environment in most transplant units have changed completely as well. And just as an example, in the Cardiff unit where I work, we know we've got a completely different setup now. The ward is segregated. There are extra checks on the side where any transplant recipient is to make sure to, double safety checks, if you like, to make sure that nobody enters your room, your single room, without appropriate PPE, washing their hands, and all the other things that we know really reduce the chance of infections being passed on. And by making those measures, we've been able to open to transplants to the majority of patients. Still in Cardiff, we're restricting this to the younger patients at the moment. So these are patients aged less than 60, but we are going to be reviewing that in the next couple of weeks based on our early outcomes over the last couple of months. And most transplant centres have followed a similar sort of approach. It's been a stepwise process. They've reopened, make sure that they can do things safely before they extend it to the sort of the hold waiting list, if you like. I think probably right now, if you're an older patient on the transplant list, so maybe someone who's over 60 or over 70, you probably want to have a discussion with your transplant team about the risks that go with COVID before you think about going ahead and being reactivated on the transplant list at the moment, and just consider what would be required. The other thing to bear in mind is that because of the drugs that we need to give you to do the transplant, your immune system is very low for the first 3 months after a transplant. So early stages afterwards, it is important that you follow the sort of self-isolation as much as possible, or shielding as much as possible for the first 3 months after the transplant, to minimize that risk of you contracting the virus. In the future now, over the autumn and winter, we're expecting levels of infections to go up. That's very likely. We don't know for sure, but it's very likely it will happen. And all of the transplant units around the country have put measures in place to minimize the effect of that on their transplant programs. So we're hopeful that we can. Certainly, we won't be in the situation we were back at the end of March. And we're hopeful that we can keep transplant programs open regardless to what's happening in the community. It might be we need to scale things back a little bit, but we're hopeful we can keep transplant programs open now throughout the winter and into the spring. But we'll have to see how we get on with that. So that's where we are transplant wise. So, and in Cardiff, we've done 19 transplants now since we reopened the program in July. So that's roughly the same activity level actually as we were doing pre-COVID. And interestingly, across the UK in July, it was the busiest month for transplants that we've ever had. So, and that's fantastic news. So it's really bounced back very quickly. And it's interesting. We don't know fully why it's happened so quickly and why things have improved so quickly. There's a few possibilities. Time will tell, I guess. One of the things is that the opt-out law has come into play in England over the summer. So, and the consent rates are certainly higher. The other possibility is that people in general are much more positive about the NHS at the moment, aren't they, because of this COVID pandemic? So perhaps people have got more confidence and more willing to help and share, but they're all conjecture really at the moment. We don't know, but time will tell. So that's transplants. Last thing that I said I'd talk about is testing and vaccines. So testing, just as they can be a bit confusing. You will have seen a variety of different things on the news about testing, antibodies, antigen, and all this kind of things. So the antigen test is the test that you have to say whether or not you have the infection at the moment, and that's the swab test that's usually done in the throat and in the nose. We're advancing all the time with this technology, so I am anticipating we'll get to a point where we've got tests that are much better than the current ones, that can be done quicker and are more reliable. They're very reliable anyway, actually, but even more reliable. And I'm hopeful that will make a big difference to us if we can get very quick tests. At present, every transplant unit in the UK has access to what's called the rapid test, which is one where we get the result back within the space of a couple of hours, because we need that to do transplants. We can't wait 24 hours for a COVID swab to come back, because by then the organ wouldn't be useful. So all transplant units have got access to those, and hopefully we can see that expand to wider units as well. And that will make things much easier to manage when it comes to COVID. The antibody test is a slightly different one, and that's the blood test that tells us if you have antibodies in your blood. Now, antibodies are the things that fight infections, and you only have antibodies if you've been exposed to the virus before. So basically what the antibody tells us is whether or not you have had COVID-19 at some point. At the moment, that's only of interest and nothing more, because we don't know yet whether that means that you are protected against COVID or not. So even if you have had an antibody and it says that you have had coronavirus at some point, you still need to follow all of the suggestions about social distancing, because it's quite possible that you can get another infection with this, and it's certainly possible for you to pass infection on to other people. So right now, antibody tests are of interest, but that's it. And the antigen test is the one that's useful. We've certainly got much better access to antigen tests now than we have done in the past. I said that we've got good access to it for our donors, organ donors. We've got access for our transplant recipients. In Cardiff, we're testing all of our waiting list patients regularly as well, to just extra security. And we're also testing our staff in the transplant unit regularly as well, to, again, extra safety blankets, if you like, to try and minimize the risk of anything untoward happening. And it's increasingly available for dialysis unit patients as well. And hopefully we'll have, if we can get these quicker tests, it will be even more useful in the future. And the final thing about vaccines, it's still relatively early days, but things have moved incredibly quickly when it comes to vaccines. We'll see in the next couple of months, I think, if we've got something that is effective or not. We just don't know at the moment whether it's going to be possible to vaccinate people in a meaningful way. As vaccines work differently for every virus. So some vaccines are incredibly effective, and one vaccination and you're immune for life. You know, things like measles is a good example of that. Others, they work, but they only work for short periods of time. And the reason for that is because the virus changes a little bit, just subtly on its own. And the flu virus is a good example of that. So that's the reason you need a flu vaccine every year. And the reason why it's not 100% effective, because there are subtly different strains of flu that go around in the community. We don't know yet where the COVID vaccines are going to sit in all of these things. It usually takes 10 years to get a vaccine up and running. So to have one done and ready within a year, which is looking like we probably will have something within a year of the start of all of this, is incredible, really. But we'll have to see how effective it will be. It's really important for anyone who's higher risk, which are most kidney patients, to get your flu vaccines if you're invited for those, because these are what what is going to cause us problems over the winter is determining the difference between other respiratory illnesses, so a standard cold or influenza and COVID, and it's going to create some difficulties as we're looking after patients over the winter. There we go. I think that was everything that I had written down that I was going to cover, and we're coming up to about time now anyway. Fiona,
So no, I was going to mention the flu vaccine and encourage everyone to take it, but you've done that and we put it in the answer as well. There's a couple of other questions there, but Judith, I'm not sure. Is there time for Mike just to briefly answer those?
I think we're going to automatically cut off at 6 p.m. So I'll just close the conference now. Maybe if we can note those questions and circulate the answers with the follow-up information. So time to close now our first virtual conference for Welsh kidney patients, and huge thanks to our fantastic speakers, Fiona and Dr. Mike Stevens. So my name is Judith Stone and I'm Managing Director of Kidney Wales. And on behalf of the 3 charities who are hosting today, I'd like to thank you very much for attending and hope that what you've heard has been useful and informative. We heard from Fiona about the impact of COVID on kidney patients and learned how the evidence from the survey is being used to inform policy. And as we move forward, Fiona emphasised the importance of getting personalised advice and support from the NHS, addressing physical and mental health needs, having clear communication from government to shielding groups, ensuring continued access to vital food and medication, and understanding what future local lockdowns might mean for shielding groups in practice. Mike then provided information about the specific considerations for kidney patients in relation to COVID, with more detail for people who have received or are waiting for a transplant. He offered some generalised advice regarding measures about returning to the workplace if you are not able to work from home, and for children and young people returning to school, and referred to the tools available from the Renal Association to assess levels of risk for different patients and for different types of activities to help you make informed decisions about your lifestyle. And we will share these after the event. Mike also spoke encouragingly about the progress with developing a vaccine. But in the meantime, both speakers really emphasised the need to remain vigilant with social distancing and hygiene practices while we begin to build our confidence in a post-COVID world. So thank you again to you all for participating. It's now time to close the conference. We will circulate a recording and a transcript to you after the event with an evaluation form. First time we've done this, so please tell us what worked well and less well and what you'd like to hear about in the future. So we'll continue to work together and with our NHS colleagues to provide you with regular information, advice and support, and we'll continue to strive to ensure that you have the best access to services both inside and outside of the NHS. So thank you again for joining us. Stay safe and we will see you soon.